problems. And we're live.
Greetings, everybody. Good morning, good afternoon, and good evening, depending on where you are tuning in from.
And we're live.
Greetings, everybody. Salaam alaikum. Good morning, good afternoon, good evening, depending on where you are tuning in from. The Quran says, وَلَا تَقْنَطُوا مِنْ رَحْمَةِ اللَّهِ. Do not despair of Allah's mercy. And in the spirit of not despairing and clinging to hope and being sustained by hope, a group of us thought it would be timely and useful to have a conversation about Muslims and mental health, especially in today's context, by which I am referring to pandemic times. It has changed life for all of us and brought in unfathomable pressures to bear on all of us. Some of us are struggling to deal with these side effects, and that's one of the things that we're going to be talking about today. But on behalf of the Shaykh Fadhlalla Haeri Foundation, I would like to welcome you all to this session. And if we have good feedback and sufficient interest, we will hope to develop a series of further programs, perhaps zoning in on specific topics. For today, though, our discussion will be broad and general, and we will not be touching on the more serious psychoses that people suffer from. We are keeping it with the range and the ambit of the normal sort of range of challenges that we all experience. Now, if you're a Muslim, you do believe that Allah's rahmah is written upon every situation, Allah's mercy, that is. But sometimes it's not easy to perceive it. And we wonder why. What is preventing us from perceiving it? Allah also tells us in the Quran that with every difficulty there is ease, and with that difficulty there is ease. And traditional commentators say that that means there are two eases with every difficulty. So there is sustenance, there is provision, there are resources available for us. How do we access them? Hopefully we will be able to point towards them today as well. So if we know that these words are true, we would surely not worry or be anxious or fearful about anything. But because of what the virus has done to us, nowadays more than ever, we are anxious and fearful. And something so minuscule and invisible to most forms of visible detection has placed the whole world into a pandemic mode. And it's this that has triggered the desire to have a useful conversation about it with some of my dear friends and fellow wayfarers on the Sufi path to awakening. So we need to be thinking about mental health. It is, in fact, the proverbial elephant in the room. And the need is there to discuss it because there's so much confusion, misunderstanding, and worst of all, stigma attached to poor mental health. And the stigma itself, in turn, creates more suffering. So we need to be thinking differently about it. But how? How should we be thinking about it? What do we need as Muslims to be aware of in the bigger picture if we are to navigate through challenging times without making it harder for ourselves? And to that end, I've invited our participants to join me in mapping out what mental health means in a time of pandemic to people of faith. Well, Stephen Abdullah, it was you who articulated this mapping most succinctly. But before I turn to you first, I would just want to say something about each of the participants today. Yakuta Morton is a dear friend, a fellow wayfarer on this path, a great grandmother, a community health educator, and a specialist in traditional Chinese medicine, and also a permaculture designer. Shabnam Dharamsi has spent a lifetime of raising awareness around mental health issues. Previously, she was in the drugs and alcohol fields, race and social justice, HIV and AIDS, sex and relationships, and holistic spiritual well-being at the individual, community, and research strategic level. For many years now, her primary focus has been in the development and teaching of an accredited Islamic counseling course in Britain, the first course of its kind, and she is also a practicing psychotherapist and counselor. Stephen Abdullah Maynard also has a background in social policy, psychology, humanistic counseling, and he works through his company in the public sector and with NGOs as a counselor, consultant, and trainer. He's also worked extensively with government departments in Britain, like the Department of Health, the Home Office, the Department of Child, Schools and Families, etc. It's a long list. He has also written the 2007 Muslim Mental Health Scoping Report for the Department of Health and Social Care. Together,